The 3M Prevena Plus Incision Management System is intended to manage the environment of closed surgical incisions and remove fluid away from the surgical incision via the application of negative 125 mm of mercury continuous negative pressure therapy. By providing a closed, moist healing environment, Prevena therapy can help reduce risk, resources needed, and cost of care for the patient. The Prevena Plus Incision Management System can be applied over most sutured or stapled incisions and is suitable for a variety of anatomical locations. This 3M Prevena Plus dressing kit contains the 3M Prevena Plus customizable dressing. The Prevena Plus customizable dressing comes folded and is a specially designed dressing for customizable application to the surgical area. The Prevena Plus customizable dressing can be used for the following wound types: linear incisions, non-linear incisions, and intersecting incisions. These dressings contain a skin interface layer that includes 0.019% ionic silver, which reduces bacterial colonization in the fabric. The Prevena Plus Incision Management System also includes sealing strips, a ruler, 3M vac drapes, the sensor track pad, the 3M Prevena Plus 150 mm canister, the Prevena Plus 125 therapy unit power supply and power cord, and the Prevena Plus 125 therapy unit, a battery-powered unit that delivers negative pressure to the surgical area. All components are single-use and disposable. Before you apply the dressing, prepare the site with the following steps. First, check the package to ensure its integrity. Do not use if the package has been torn or the sterile seal has been compromised. Use aseptic technique to open the sterile dressing package and remove the dressing. Use the enclosed ruler to measure the incision before cutting. Cut the foam dressing to the length necessary to cover the incision. Remove bottom release liner 1 on the foam dressing to expose adhesive seal and white fabric located on the bottom of the foam dressing. The white fabric covers the incision. Add sealing strips to the ends of the foam dressing. Liner 1 must be removed from the dressing before applying sealing strips. Sealing strips are tacky on both sides. Place sealing strip on the end of the foam dressing, creating a continuous seal. The strip should be placed half on the dressing and half off the dressing and overlap the adhesive seal on each side of the dressing. This ensures a seal all around the edge of the dressing. Repeat strip application on the other end of the foam dressing. Remove the remaining liner from the sealing strips. With sealing strips applied, position the foam dressing until the adhesive seal and white fabric are facing down. Center the foam dressing over the incision surgical closure. Ensure adhesive seal and white fabric are facing down. Press down around the length of the adhesive seal to ensure adhesion to the skin. Peel off release liner 2 from the top of the adhesive seals. Trim 3M vac drape as necessary. Ensure a minimum overlap of 1.2 inches or 3 centimeters when using multiple pieces of drape. There is no drape under the blue handling bars. Carefully remove the middle section of layer 1 from the drape to expose the adhesive. Leave the two end sections of layer 1 intact to maintain drape stability during application. The drape should be held by the blue handling bars. With the adhesive side down, apply drape over foam and onto intact skin. Lift the drape at both ends and remove the 2 remaining end sections of layer 1. Smooth out any wrinkles in the drape. Carefully remove striped layer 2 from drape. Remove the 2 blue handling bars. Add additional drape as needed to cover foam dressings in various configurations. Smooth drape to remove creases and seal joints, ensuring an occlusive seal. All liners must be removed before additional drape is used. Press the drape down around the length of the adhesive seal to ensure adhesion to the skin. Minimize any creases or wrinkles in the drape. Excess drape can be used to seal leaks. Choose the sensor track pad application site. Pinch drape and carefully cut an approximately 2.5 cm hole through the drape. The hole should be large enough to allow for removal of fluid and exudate. It is not necessary to cut into the foam. Apply the pad, which has a central disc and a surrounding outer adhesive skirt. Remove both backing layers 1 and 2 to expose the adhesive. Place the pad opening in the central disc directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. To connect dressing to the Prevena Plus 125 therapy unit and begin therapy, first, remove the canister from the sterile package. Hold the therapy unit and canister vertically or horizontally, one in each hand, and slide the bottom of the canister into the slot on the bottom of the therapy unit. Close the canister against the therapy unit. The upper locking tab will click when the canister is secured. Connect the Prevena Plus connector to the canister by aligning and plugging the connector at the end of the tubing onto tubing ports on the side of the canister and push together firmly. Connect the sensor track pad tubing to the Prevena Plus canister. Push the connectors together and twist the connectors to lock. Now you're ready to begin therapy by pressing and holding the center of the on-off button for 3 seconds. The Prevena Plus 125 therapy unit, while in operation, may have a moderate sound emanating from the unit. All 7 therapy light indicators will illuminate with a green LED, indicating therapy is running. With therapy on, be sure to assess the dressing to ensure integrity of the seal. The dressing should have a wrinkled appearance and the foam bolster should be compressed. When directed by the treating physician, Prevena incision dressings can be used with negative pressure wound therapy provided by the 3M Activac therapy unit, the 3M VAC Ultra therapy unit, and the 3M VAC RX4 therapy unit. To connect dressing to the VAC therapy unit and begin therapy, push the connectors together and twist the connectors to lock. Ensure the clamp on the canister tubing is open. Activate VAC therapy at negative 125 mm of mercury continuous. Do not choose any other negative pressure setting, intermittent, or DPC modes of negative pressure. Remember, therapy should be continuous for a minimum of 2 days, up to a maximum of 7 days. For more product demos and application techniques, visit 3m.com/medical.